Long before COVID-19 took hold across the globe, face masks were commonplace in many East Asian countries. This includes places like China, Japan, South Korea, Thailand, and other nearby nations. These cloth or surgical synthetic fiber-based masks have not just been used when people are sick, but in a variety of cases. The covering helps in preventing allergies, protecting against air pollution or sun damage, and even helps people get some extra privacy when in a crowded space. When flu season picks back up later this year, many populations across East Asia will preemptively mask up again as a form of protection. Especially if an individual is sick, it's considered basic etiquette to put a face mask on in order to stop the spread of infection. For years, Dr. William Jankowiak has studied these cultural norms with an emphasis on societal standards in China. Jankowiak is a professor of anthropology at the University of Nevada, Las Vegas, and a recognized expert on urban Chinese society. Looking back in history, he says that experts can't pinpoint exactly when face masks were first seen in East Asia, but there was an uptick in their use starting in the early 1900s.
Chinese researchers were responding to general health crisis, cholera, smallpox, malaria. And they realized that these were transmitted through the air. And so they designed, and by stitching, their own face masks. And they really encouraged people to wear it.
While education and literacy rates in these regions were low at this time, the government reached civilians through a variety of methods.
I remember in the 1981, when I was in Inner Mongolia, at the start of every movie, there would be a little short 5 minutes showing germs through a microscope and telling people that this was something that you didn't see, but was real. So you can see in that cultural environment where the educational level was quite low in terms of transmitting, the mask would become one of the ways, which people might not understand how the process went, but the intellectuals did. And so they encouraged sick people particularly to wear the mask. So it became somewhat associated, if you will, with when you're sick, you should wear a mask.
Jankowiak says that in these early years, there were mixed uses for masks, the two big ones being health versus beauty. Because of this, face coverings were viewed by some as a feminine item.
I discovered only 25% of the men wore it in the winter, but about 85+% of the women did. And these are women and men who were not sick. So why did they wear the mask? Where I was very cold. And it was thought, and accurately so, that if you wore a mask, the hot air would blow back on your face. And so you would stay warm. And when I pushed women on why they wore it, they said it also protected your face from drying out. And so the idea of keeping a more moist, fresh face was really at the forefront for women. So why did only 25% of the men wear it? And because it wasn't manly. They would even remember teasing, this would be like junior high school, maybe high school, teasing guys who wore it and calling them horse mouth. And the idea is that real men don't wear it. Now, again, you also saw that in the spring where they would have a thing called da feng, the big wind. These would be 50, 60, 70 miles an hour wind and blue sand from the Gobi Desert in. And you would see overwhelmingly women wearing masks to protect their skin. So we have a health issue, but we also have a beauty issue.
Fast forward to the 1920s in China, and wearing masks for medical reasons became much more common. But with these items available for purchase in the U.S., why were masks so much more common in China and other East Asian cultures? Jankowiak says that much of the answer lies in Chinese cultural and societal norms.
China is what we would call a tight culture. America, but it depends on the particular state in America. But if you look at the East Coast and West Coast, they'd be called loose culture, meaning that there's norms, but they give a lot more slack if you break the norms. Tight cultures don't give slack on breaking the norms. And so out of that, once something gets established, it becomes normative to follow a pattern that everyone else is doing, regardless of how you personally might feel. So once you begin seeing the mask being associated with something that protects you and then gets extended out, you protect those who are sick by wearing it. So you can see the mental template is already set way before we have the SARS and the COVID influenza outbreaks, that Chinese are set, if you will, to protecting themselves and each other.
Before the 21st century, there were no specific Chinese government directives saying when and where citizens had to wear a mask. It wasn't until recently that these guidelines became much more formalized in China and other countries around the world. For millions of Americans, the onset of the COVID-19 pandemic was the first time they had bought and worn a face mask. The idea behind it was completely foreign, and this newness required experts to break down how a mask works. One of these experts is Dr. Lindsay Marr, a professor of civil and environmental engineering at Virginia Tech. Marr studies the transmission of viruses in the air.
Airborne viruses move around in the air in very small particles, and the way that face masks work is that they block those particles, they trap them. And so they work in both directions. If you happen to be infected and you're wearing a mask, the mask blocks those viruses that are coming out of your nose and mouth and prevents them from getting into the air where they could float around for a while and other people could be exposed. And masks also work to protect you. They can block, at least partially, virus particles that are in the air that you would otherwise breathe in. They get trapped by the mask. So I should clarify that virus particles, when they're released into the air, are carried in respiratory droplets that are really tiny, and we call them aerosols. They're too small to see. They move around like cigarette smoke particles.
And different masks have different rates of efficacy. Most Americans are familiar with cloth masks, but if you're looking for the greatest level of protection, Marr says respirator masks like a KN95 or a KF94 offer high rates of filtration and a tight fit on the face, creating an insulated barrier. Past respirators, there are surgical masks and then cloth masks.
If you have a good-fitting cloth mask with a filter built in, you can get very high levels of overall filtration efficiency. But the poor quality cloth mask, just a single layer of a loosely woven material, isn't going to block much. So kind of from top to bottom, when we're talking about the respirators, we're looking at 90% or better protection. If we're talking about surgical masks, it might be 50%, but it's pretty variable depending on the fit. And for a cloth mask, it can be anywhere from single digits to, if it's a good fitting one with a filter, maybe 60 to 80% protective.
With the pandemic winding down, you might be wondering, why are we still talking about face coverings right now? Well, these items can be useful in protecting against more than just COVID.
Over the past couple of years, while we've been wearing masks and doing other things that also help prevent transmission of COVID, like trying to avoid crowded indoor spaces and social distancing and things like that, we have seen almost no flu at all. It's starting to come back now, but typically we'll have thousands of cases of flu every winter and tens of thousands of deaths. And we just did not see that the past couple of years. And I hope that now that Americans have gotten more used to wearing masks, that we will also consider wearing these during periods of high rates of flus and colds and COVID in the future, and that it's more acceptable and also hopefully more accepted that if someone's coughing in public, that hopefully first of all, ideally they should be at home, but if they are, that they're wearing a mask.
For so long, American norms meant powering through sickness and still showing up for work or a social event. However, Marr hopes that this pandemic has made people more aware of the importance of staying in when sick, or at the very least wearing a mask to protect others. Looking back on the past 2 years, Jankowiak says COVID-19 has become an interesting test case on face masks. Across the country, they're now available for purchase at nearly every pharmacy, grocery chain, and store. If you go out wearing a mask, it's much more accepted today than before the pandemic.
This was not normative in American culture at all. And now I think you're going to see it in certain pockets at certain times. It'll be interesting to see if this develops. First ad hoc, but then that. Also, it's enforcing the norm as the hospitals. But here in Nevada, if you go to any hospital, you have to wear a mask. The hospitals are enforcing on their own. It's not the government in Nevada, but the hospitals are. So all of a sudden, you can see how that would be the repetition if you go to the hospital, you wear a mask, and all of a sudden they associate a mask protects you against disease. It helps you and also others. So that becomes kind of like a vehicle, if you will, to internalize a new normative element that then can be extended out into society.
In East Asian countries, Jankowiak has no doubt that mask wearing will continue post-pandemic. For the U.S., only time will tell. What else will we do with the piles and piles of masks scattered around our house? To find out more about this topic and our guests, Dr. William Jankowiak and Dr. Lindsay Marr, visit viewpointsradio.org. For more behind the scenes, search Viewpoints Radio on Twitter and Facebook. This segment was written and produced by Amira Zaveri. I'm Gary Price. Coming up on Viewpoints.
If you're going to innovate, if you're going to build the future, it's not enough just to have a fancy pedigree or a really nice resume. Got to be clear what value you can add as a professional.
How to jump jobs in an economy that still favors workers. Then,
I believe that every region and every community across the planet should be able to feed themselves.
The struggle to keep America's farmland in the hands of farmers. I'm Marty Peterson.
and I'm Gary Price. These stories in depth on your public affairs magazine, Viewpoints.
And that's Viewpoints for this week. Follow us on Twitter, Facebook, and Instagram to learn more about upcoming shows and find a library of past programs on Apple Podcasts, Google Play, and Spotify. Plus, you'll always find previous segments and more information about our guests at viewpointsradio.org. Join us again next week for another edition of Viewpoints.